last 1 month, we have had concerns that we may be running out of some certain vaccines. Polio vaccine has been on the radar, as MR, malaria-rubella, also has been on the radar in terms of shortage, and you members of the fourth estate have reported. I have emphasized and indicated that whereas the stocks were running short, we were making and had already made arrangements actually to make sure that we bring the vaccines so that there is no gap. I am here therefore to confirm today here we are receiving 1.9 million doses of MR, which in the coming week is going to be distributed to the sub-county facilities. Within the week, last week and through to the weekend, we also received 2.5 million doses of polio vaccine. So I'm here really being very satisfied with what I have seen and the confirmation that indeed the vaccines are here, are going to be distributed, and for you is to assure Kenyans that indeed we do not have a shortage that has been talked about in the past few weeks. So I'm very satisfied, and I want to express my gratitude to the team that has been ensuring, even in terms of fast tracking the importation of this vaccine happens. I'm particularly thankful to UNICEF, which partners with the government of Kenya in terms of the importation of these vaccines into the country. So again, to assure the report, we did move in with some very specific leads in terms of now meat, as it were. Sulfites are not to be used on meat, and I made that statement very clear. Directed by myself to move in, join hands with the county public officers and ensure that there is action. What was action? The action was to move, pick the samples of meat, take them through our national laboratory where they were analyzed, and where then there was these results which I shared with Kenyans yesterday. Let's mind where we pick our foods, how we buy our foods, how we treat the foods. It is not always that your naked eyes you can tell the food has anything the problem. But again, we are being told, even from a health point, red meat, and red meat. We are being encouraged to move away from this kind of diets that every day for Kenyan is nyama choma. It is red meat that you have boiled, it is there. From a health position, I think we are being discouraged, and we are being told or encouraged to move more towards the white meat, as it were, or move to more vegetable-based diets, as it were, long term. With the conversation that we are having, I think that I'm in touch with COFEC, responsible for consumer education, and we are putting together a conversation that is going to be messaged around this. Again, is a lifestyle issue. In facilities where the resort failed, the product, specifically the meat, was seized. The butcheries were cordoned off. The persons who were trading in that would expect to actually be charged in a court of law today in accordance with the law of the land. They will have to take personal responsibility, because for you to then be the one transacting, it means you're culpable up to a point. That charge is what the counties are working on today. My team, public health team, that again is involved in matters policy and intervening with TA, or intervening whenever a matter goes beyond a certain threshold, is working with these teams for them then to prefer charges, as a matter of fact, today.